So this is the Endocrine second part. Okay, so you guys know yesterday we didn't get a chance to finish it. Was it yesterday or the day before yesterday? We didn't get a chance to finish the endocrine system because it was kind of big. Okay, kind of a large section. So I was still on 710. So those of you who have your books, um, you're going to open your books to page 710. I'm just putting this on this side so you guys can have my website. Okay. Don't forget to go on my website for my books, and you can go on my website. Hello. And you can go on my website for the courses as well. Okay, so this is your second portion of the endocrine system. We just did a live for just pretty much showing you how to kind of beat the odds of not getting hired. I have that video in private because I have to edit that video, but you guys will get a chance to take a look at it. So the endocrine system that we were working on the other day, it was pretty long. So that's the reason why I wanted to go ahead and split that up. Okay, so if you guys have your book would be The Language of Medicine. I'm going to pull up the books real quick just so we can kind of show the books. There are some people who do want to see what type of books we have. And that's why I put the books up. Usually, every platform, I kind of put the books out. Okay, so even if you are working by yourself, if you're tuning in by yourself or you're studying by yourself, these are the books that you will need for the program. So this is pretty much your ICD-10 and your CPT book, okay? These are the books that's going to help you learn coding, okay? That's going to be your HCPCS book. We will use that book. That book is for durable medical equipment, and that is the one that we use. Now, you can go to AAPC and you can get theirs, or you can get any other HCPCS book, that's fine. But I do want you to stick to the AMA CPT, okay? They're the only ones who actually make this, but you can find this actually on Amazon as well, AAPC, and they're all the same. So don't worry about getting a different one. These you can, but AAPC kind of likes you to get their, ICD-10 book, only because their test is derived from their book. But if you guys, when you guys archive this, the ISBN numbers are also here, okay? And in the links below, I also have links to the ICD-10, the CPT, and the HCPCS book as well. What I probably will do is the same thing that we did last time. Generally just we can put those links right over here so you guys can kind of get the links. After we finish with this one, they should show up again. If you guys are archiving and you want these links on the side, and you do have the Kindle, this is just a way for you to kind of look at some of the ICD-10 CPT books for free. The first few sections, I would do that, especially if you're not ready to, purchase these books, because they are a little bit lengthy. But I don't expect you to get the books all at one time. I would do one, another. What's that one I always talk about? Hi, Isaiah and Kamai. I know Isaiah and Kamai, and some of these books that you're going to get are going to be a little bit lengthy. Okay, so let's get that last HCPCS book. This is the same thing, and this is also a Kindle. You guys know I like ebooks, so I do the ebooks, but if you like ebooks, that's fine. I'm an ebook person. I know I didn't used to be, but I am now. Okay, so here is the medical billing books that you need. And here is your step-by-step book. That's for the beginners in the coding program. Okay, and here is your language of medicine book. This is what we are going to use for your medical billing and medical coding course. Now, this is almost over. But this is the book that you're going to use. I think we have like 2 weeks left in this course. We have like 2 weeks left in this course, okay? So just kind of take heed to what we're doing and kind of follow along. Make sure you check the side because that's where those links are going to be. So right now I am on page 710 and we were talking about the endocrine glands. And this is what you're going to also put on your index cards: your thyroid, parathyroid, adrenals, cortex. I'm not going to give you all the definition for them because I want you to put them on your index cards. The medulla, yes. Pituitary gland, yes. Put all of those on your index cards. Follicle stimulating hormone. You guys definitely need that FSH. I'm going to show you this real quick. Let's kind of see if we can get the screen shared, just because I want to show you that bottom, which you probably have already anyway. Even if you have another book, you should still have the same thing that I have. It may not be on page 710 or 11, but you'll have the same thing. So we still talk about the ovaries and testosterone, progesterone, all of that. Now, you probably won't have any questions on those two. The adrenal cortex, the medulla, the ovaries, pancreas, yes. Okay, I'm on page, still on page 711. Okay, the thyroid gland is going to be very important, located in the neck on either side of the trachea. I showed you an illustration of that the other day. So they may have another one in here because they're back on the definitions. And usually the definitions and abbreviations, they're pretty much the same. So even from the last class, do you guys have any questions on the last class that we took? I see Kamai. Okay. Insulin, glucagon, progesterone. We did that one. That one I want you guys to get. So, okay, so those are pretty much related terms. Other than hormone and receptor cellular or nuclear protein that binds to a hormone so that a response can be elicited. Now, the receptor may be on there, but I'm looking more of the hormone, looking for more of thyroid, looking for more of estrogen, things like that is what I'm looking for. Because if you do work at a doctor's office, you are going to have to be familiar with those things. Okay. Combining forms. Yes, you still can go over the combining forms. My main point is that you go over the abbreviations and you go over the definitions. We already went over the pituitary gland. That's where we are right now. They're just pretty much showing you that we were looking for a picture like this yesterday. Pituitary gland. You remember we were looking for a picture like that yesterday? So those of you who were in the first portion of the endocrine system, that's what we were looking at yesterday. The suffixes are in here. Glucagon, epinephrine, definitely the epinephrine. There's going to be something on the epinephrine. Definitely something about blood thinners. So you guys make sure you get that one down. I wonder why they got the blood conditions in here. I guess because they're epinephrine. And this is like the suffixes that I'm looking at right now. Emia, they just giving you a couple of suffixes, but that's not, something that you're going to see on your test, like thousands of, suffixes and stuff like that. Okay. So yesterday we went over a couple of things. Today, I think we left off with the pancreas. So today we're going to start off with the thyroid gland. Okay. Today we're starting off with the thyroid gland. So the thyroid gland, enlargement of the thyroid gland is called goiter. Okay. Endemic. Goiter. Okay. Endemic. goiter occurs in certain regions where there is a lack of iodine in the diet. Iodine, as in, what is that, y'all? Salt? Mm-hmm. Goiter develops when low iodine levels lead to low T3 and T4 levels. This causes feedback to hypothalamus and adenophysis, stimulating them to secrete releasing factors. Now, listen, on your exam, they might have iodine, or what is iodine, and they may have something in it. Uh, you might hear something like that when the provider is doing the intake for the patient, or the provider is doing the report. The patient had 25% iodine in the XYZ. Okay, and not to say that you're going to code it, is to say that you will recognize what the provider is saying in his notes. Or, in other words, what's wrong with the patient? Why did the patient get that diagnosis? Okay. Another type of goiter is nodular or adenomatous goiter, in which the hyperplasia occurs, as well as formation of nodules and adenomas. Gosh, I can't even think about nodules up in there like that. You know what I'm saying? It's like can you feel that? And you'll be scared to death because you think it's cancerous. I mean, when you go to the doctor, you'll find out whether it's just cancerous or not. But when you think of something like that, it scares the heck out of you. When you feel it, you might feel some type of nodule or something like that. Okay, so hypothyroidism, overactivity of the thyroid gland. Okay, yes, you will have something like that on your test. It could be an open and closed question. And that's kind of like, when your eyes are more wider open. They had a guy on Twitter the other day. He took his eyes and he like popped them out and he popped them back in. It's not funny or anything like that, but he thought it's something that he does. But in hypothyroidism, you do see people with either have a wider neck or no neck, or their eyes are a lot wider. I don't know if I can show this picture, but I don't want to show it. Don't forget, if you join my class, you get the medical terminology book free. What you do is you're going to download that book. Okay, I forgot to mention that in the last class. You're going to download the medical terminology book. It's the same book as this. It's just a different year. It has the same thing that we're talking about. Once you go to sapphirecoding.com, click that link that says enter the courses or see the courses. When you download that orientation and those courses, this book is in there. Okay, so don't spend $140 on this book. All right, your whole class is less than that. Okay, thyroid carcinoma, cancer of the thyroid gland. So that would be something that you're going to look up in the CPC book if it is in one of your cases, if it's one of your cases that you're looking for. Adrenal cortex, we talked about adrenal cortex, but briefly. Adrenal cortex, I don't want you guys to dwell on that too much. The hypersecretion, adrenal viralism, excessive secretion of adrenal adrenals. No, we're not going to focus on that because that's not something that's going to be your test. When it's something that is more, hypothetically speaking, laboratory-ish, that's not going to be on your test. Okay, they're giving you like examples: adrenal hyperplasiaism, or more commonly adrenal adenomyosis or carcinomas. I haven't seen anything like that on the test, and basically nobody has told me anything about adrenal glands on there other than what they do: excessive secretion of adrenal androgens. That's it. But you still can look at 720 and go over that, okay? Because it's pretty much talking about drug suppression therapy. What they're doing for treatments, okay? The only thing that I think they're going to talk about on the CPC as far as treatments and stuff, when you get to pathology, that's when we're going to start talking about that, what they're going to be using. That's Cushing's syndrome. Well, we can do that one. Let me see. I can show you this. I want to show you this with the Cushing's syndrome, okay? I want to show you this one because I've seen a lot of people like that. That's what you call Cushing's syndrome. It's not as invasive as the picture that they had before that, so I don't like to show those. When you see your neck and you see how mine's is like this, and you see some people with it like that, it's called Cushing's syndrome. Cushing's syndrome also affects your body. They might have a picture in there like that. How you see people that might have a flat, they might be like this in the front, and then they're like flat in the back. Group of signs and symptoms produced of excess cortisol. from the adrenal cortex. That's just it's not in depth, but it does give you a little bit of information. Number of signs, including obesity, increased cortisol, that gives you a moon-like fullness face, and we just saw that. This could be caused maybe a tumor or adrenal, not all the time. Like when you go to the doctor and they give you all the tests, then they come up with that. Okay, and in this section, in the endocrine system, they're giving you a lot of different things that are going on that has to do with the endocrine system, because you'd be surprised how fluid and liquid, salt, and all these different things affect your body. And they're giving you stuff like if your face is changing, this is what happened. What if you have, something coming out like this? I'm gonna show you this one right here, which is a good one. Addison disease. You see how they're showing this? Oh, okay, hold on. You can't see it. I'm going to put it so you can see it. It's not showing something is wrong. Look, it's not showing something is wrong with her, but it is showing a type of disease that is not a bruise or it's not a cut or something like that. It's showing you something that is familiar with this provider, which is his specialty. Okay, as an endocrine provider. In clinical practice, most cases of Cushing's syndrome result from chronic use of cortisone-like drugs, such as steroids, examples, or medicine. It don't have to be like drugs. Examples are the cases in young athletes seeking to improve their performance in patients. Because some people you see, they're not on drugs. You see people that look like that plenty of times. I mean, you see people even when they get older, they have that extra, the extra down there. What's her name? Had the surgery. I mean, she was overweight, but she had the surgery and they took that thing off. The thing off. You hear me? It was like, what's her name that had the surgery? And she lost a lot of weight and she had this hanging down. 1,000-pound sisters. But when she was heavy, that's when it was like that. Okay. So I'm on page 721, and adrenal, medulla, pancreas. We talked about all this the other day. Here it is. So this is what we were looking for the other day. We didn't quite get up to it. So I knew that eventually they would start talking about diabetes mellitus. Test, yes. When I say test, you know that's something that you need to definitely study on your test. So DM is diabetes mellitus. Lack of insulin secretion or resistance of insulin in promoting sugar, starch, and fat. Metabolism in cells. Okay, in diabetes mellitus, insulin insufficiency or ineffectiveness prevents sugar from leaving the blood and entering the body cells, where it is used to produce energy. There are two types of diabetes. We know type 1 and type 2. Type 1 is more often in younger people and children, and type 2 is more of an adult when it kind of develops into 2. I'm not going to read the whole thing. I want you guys to read the whole thing. I just wanted to make sure that we did have this in this book. I'm on page 722, and we have, they're giving you type 1 and they're giving you type 2. Do you need to know this for your test? Yes, you need to know this for your test. Hi, Valerie, how are you? Yes, you need to know this for your test. And I'm going to show you where it is in my book, because you again may have a different book and you may have a different page. But this is what we're looking at right here. You see, they're giving you 1 and 2. And remember what I told you. Have your CPT book right here. Have your CPT book right here. Why, Ms. Lambert? Because your CPT book and your medical terminology book are complicit. They go hand in hand. If you have something on here and you're looking in there, you need to look in your CPT book because you just want to justify it. Go to that section in your CPT book. Okay, go to that section in your CPT book. Good. I'm very happy to hear that. So when you're studying, you guys remember what I said when you're studying. It's better. I know my desk is always cluttered. Yeah, I even had extended this. And let me tell you something. I had a different desk that was smaller. I literally made my desk. Y'all know Ms. Lambert don't sugarcoat nothing. I told my grandson, go get the wood, go get the so and so, make me a desk. Me and my younger grandson literally just extended my desk. If you don't have a desk, that's what I want you to do. Make sure that you have your space. We got two 2x4s, and we got this flat thing for $4, and we got the 2x4s for $2. I have this big giant desk that I put little beads on for $11. Okay, so don't tell me y'all don't have no space to study at. I don't care if you have a room with a full size bed or a twin size bed. Get your corner, because if you guys look at some of my videos back in the days, I had like this space teaching. I had this much space literally teaching. Now, of course, I have this whole big room. But if you don't have space, I want you guys to make space for your training, because you're going to have to put your books. I have even another extension over here. You guys don't see how long my desk is. I literally had to extend my regular desk because it was just too small. So, just take heed to that. The books have to be open in order for you to be retaining what you have. You guys know I use this. Don't forget, check Barnes and Nobles for this. This is kind of like a go-to type of guide. And I want you guys to make sure that you get something that you're going to train with. Do not forget, if you register for the class, the medical terminology book comes with your program. This book comes with your program. It's an automatic download, okay? But that's if you get the program from www.sapphirephysiciancoding.com. Click on that little square thing. It'll take you to my bookstore. So you guys know we went through the bookstore a few minutes ago. You can also look at that as well. Okay, so again, it's better to have your books by your side in case you are not familiar with a word or something. You guys know I can't pronounce nothing. But if you're not familiar with the word, you can type it in on search engine really quickly and you can get the definition of it, okay? The diabetes section is very important. You see how we have, I'm going to screenshot this. You guys see how I have the CMS guidelines open. The guidelines is going to be on your test. Those diabetes is inside the guidelines. If you do not have your ICD-10 book as of yet, I want you to do two of two things. I know that sounded crazy. Two of two things, okay? Go on your cms.gov. This is it right here. And this is where you're going to study. That diabetes section is in here because this is going to be a part of your test. We're not copyrighted anything. This is literally free to everybody on the website. This is giving you the history of ICD-10. How did it come about? What is diagnosis? Who was the creator of ICD-10? Once you come down here, you guys see where we're looking at the ICD-10 official guidelines, conventions, alphabetic index, the use of and, the use of includes, excludes, notes, excludes one, excludes two, etiology and manifestation. Man, I can't wait till we get into the coding. Wait till we get into the coding. C and C also. Listen, when we get into coding, I know I'm going to see more of y'all in this classroom. More of y'all going to come in the classroom than archive. Because y'all know after I do the prelay, I can't publicize the coding class. The coding classes are private. So I am just now starting to make the rest of the class private. So after you guys get in, some of you who are already in the classroom, you got to join the program. Okay. So again, in these guidelines, there will be a diabetes section. Okay. There's going to be a diabetic section, and you're going to have to know the differences between 1 and 2, and you're going to need those codes. All right. So again, I'm going to still put over here, which I think I did in the last section, the ICD-10 book. Okay. From the Kindle, the ICD-10, I think I put them up here. ICD-10 and the CPT book. If they're not here, they're in the prior chat that I just did. Okay. So again, that's your diabetes section. I want you to make sure you're good on that. Diabetes 2 and type 1 and type 2. Okay. Patients often older in 2 and patients in young or early childhood in 1. Okay. And it's mostly because, you're a little overweight or, you're dieting. I mean, I haven't really heard a reason for the diabetes just yet. Okay, so both type 1 and type 2 diabetes are associated with primary and secondary complications. The primary complication of type 1 is hyperglycemia. Hyperglycemia can lead to ketosis. I'll never say that. Ketoacidosis. Okay, fats improperly burned, leading and accumulation of ketones and acid in the body. I'm not going to read it. I want y'all to go ahead and read it. That's going to be for your homework. Okay. And they also have comparisons of type 1 and type 2 as far as what they do, the treatments. This is what they're giving you. Okay, so I'm going to take that one down. Let's stop the share on that. That share here. So this is what I want y'all to see. These two comparisons. So this is good. When you guys get ready to do your studying after me for your homework, make sure that you study this portion right here. Okay, because some of that looks like it might be on your open and close questions on your test. When I say open and close, I'm talking about the portion of your test where they're just asking a question and you're choosing A, B, C, or D, not the cases. So you guys know that there are going to be probably 10 cases on your CPC. You only have about 4 to 6 questions on language of medicine, medical terminology. But you guys know throughout your exam, you have to know medical terminology, okay? So type 1 usually occurs before age 30. Type 2 occurs after 30. It's just, to me, it's kind of perpendicular to each one. So I'm not gonna read it. I want you guys to go ahead and do it. Type 1, insulin. Type 2, diet loss, okay? They have so many new gadgets for it, so you can test yourself. And, just again, take your time, and do your work and take heed to what you need, because that's the only way you're going to pass that test. Okay. This is a question right here. Type 1 formerly was called juvenile diabetes. Type 2 formerly was called adult onset of diabetes. Now, something like that, it will not be on your test to say what did they used to call or what they used to call, diabetes. It will only ask you to clarify type 1, type 2, or which one can you clarify is as in the one for children. Okay. As a result of hormonal changes during pregnancy, it's called gestational diabetes. You have diabetes while you are pregnant. All right, I can't show this picture. This picture is a little rough. Okay, we got to find another picture. But this picture is just pretty much showing you where you would have a stroke, retinopathy, eye, glaucoma, coronary artery disease here, gastroparesis. It's just showing you stuff, but it's not a picture that I can show you. Nephropathy. I can't talk. But I want you guys to get all those things down, gangrene. And you know what it's doing? It's really giving an idea of what diabetes can affect and whether you can have a stroke or XYZ, and you can. I always wonder, well, how long can people take diabetes? How long can they take diabetes? Can somebody take diabetes at 90 years old or whatever? It's just they can't take it. After 80, 81, 82, even after 80, having the dialysis over and over and over, it just eats up your veins. It's just over and over, pulling that blood out, pulling that blood back in, and eventually it starts feeling like you're ripping apart. It starts feeling like you're ripping apart, and eventually you have a stroke. And that's what they're showing you right here. They're showing you what it can affect. And it's a body, and it's showing you what diabetes can affect. Nephropathy, y'all know that's the kidneys. Diabetes can affect your kidneys, can affect your eyesight. You can have a stroke. You can get glaucoma, coronary atherosclerosis, sclerosis as in hardening of the arteries, gastroparesis, all of these things, constipation, everything. Diabetes has all of these effects in them. Okay, you can get gangrene. Your leg can be cut off. so many different things that you probably have already seen in diabetes. Yes, we know we have diabetes throughout our family. And even when I was taking the Ozempic, I used to get, one might have one or two disagreements with me taking the Ozempic, but them not knowing that I have the diabetes in my program, and they did give it to us because it would prevent us from getting it. So, a lot of people didn't know that, but, I did a segment on something like that. But again, this is the section we were looking for from the other day that gave us a little bit more exclusives on diabetes. And yes, I want you guys to go through this. Give me a summary on this one. Make the summary 150 words on diabetes, okay? Type 1 and type 2, okay? So again, remember what I just told you about the stroke, retinopathy, eyes. These are things that it can affect. These are the things that you're going to put in your summary, okay? Secondary complications of diabetes mellitus. Complications can be avoided or minimized with optimal glycemic control. This is a good example right here. You see where it says glycemic? And you can't see that. All right, so I'm going to show you this word right here, because you guys remember I was talking about how I keep that dictionary over there, because sometimes I go in there or sometimes I go on search engine. If you see a word that you might have a question about and you're not sure what it is, search it. Don't move. Don't keep going. Stop. Type it in your phone or type it in wherever and stop, so that you can understand what that word is, okay? And then you're going to put that word on an index card, okay? So as you're reading and doing your homework, no matter what reading and homework that you're doing, stop, find out the definition of that word, and then you're going to keep it moving, okay? So now they just kind of start talking about insulin and, how you take the insulin, XYZ. I mean, this is something that we've dealt with for so many years because it's in our family. It's not new to us. But I wanted to make sure that it was explicit to you, because this is stuff that's going to be in your test, especially something like this. They're going to ask a couple of open and closed questions on this section. And if you want to know what AAPC is going to have on their test, just go on aapc.com and it'll show you. Go into CPC and it'll show you what's on it. There are many different types of insulin. Insulin can be rapid acting, peak at 30 to 60 minutes and last 3 to 5 hours. Okay, 3 to 5 hours. The peak is really the last 24 hours, depending on how much you can take. That's the intermediate acting one. See, we dealt with this for so many years. It's like, but this is not going to be in your test. What I just said prior, that's going to be in your test, okay? Pituitary gland, we talked about that. Gigantism, acromegaly. And they're talking about this because this is your endocrine system. These are things that make you, your body changes. So that's why they're putting acromegaly in there and gigantism in there. They just showing pictures of people with gigantism. This is like, you guys did you ever wonder how those people are so tall? Like basketball players are like very tall. And what's her name? Randy Greer. I can't think of her name, but she's like huge. And it's a part of the endocrine system. These are like cells that make these people like this. Gigantism, excess growth, hormones. See how it's relating to the endocrine system? Increased height. I want y'all to definitely read this one. I'm on page 725, and it's not going to be detailed on your CPC. I really don't think this is going to be in the CPC, and I haven't heard anybody tell me of this, but I still want you to read it, because what if, dwarfism, put that on your index card, congenital hypersecretion of growth hormones. Why does it involve the section 18 endocrine system? Because it's the endocrine system. These things are forming other type of functions. It doesn't have to be, endocrine system, musculoskeletal system where it's involving breaking bones or how many bones or XYZ. Don't forget to look at that video. ADH, syndrome of inappropriate excessive secretion of androgen hormone. Now, I don't know, I don't remember the ADH, but get that down anyway. Syndrome of ADH. I want you to get that down. I'm on page 726. Syndrome of inappropriate ADH. Insufficient secretion. That's not going to be on there. So this I want you to get. I'm on page 726. Endocrine glands, adrenal cortex. I know we went over some of this before, but because it's explicit in your test, explicit, complicit together, involved. Okay, adrenal cortex, adrenal medulla, pancreas, parathyroid glands. Okay, pituitary anterior lobe, pituitary posterior lobe. Remember we talked about that the other day. Thyroid gland. Okay. Test, we don't need the lab test. We don't need that. We don't need that. Well, serum and urine test. Let me see. Did they show you how to do sticks? All right. So they don't have the lab sticks on here. We do the lab sticks and we do pathology, the urine test. That's not here, so that's not, nothing. Pathology, I will show you how to do that. How we're going to code that. Why we write off those zeros and we do that once in charge, okay? No tests. Computer tomography, CT, you guys already know that. When we get to radiology, you're gonna have to know that because you may have radiology. You might have radiology on your chest, you might not. Okay, thyroid scans, your ultrasounds. We went over that. We got radiology coming up soon anyway. Radiology is on chapter 20. So radiology becoming radiology. Did we do pathology already? I'm sorry, y'all. I'm just checking. I don't see pathology. We're going to do pathology. I wonder why pathology is not in here. Maybe they're using it as pharmacology. I don't know. But we're going to figure it out. We're going to find out. Y'all got to do pathology. So I'm going to use the CPT book. I'm going to use the CPT book for pathology. All right, y'all? I'm going to give you other tests that I have, but we're still going to do what's in here, okay? All right, so now we are up to abbreviations. Okay, I'm on page 728. I'm not sure what page you guys are on. So remember, if you register for the class, once you get one of those courses, you have an automatic download. The book is in there. This book is in there. You don't have to purchase. DM, make sure you get the DM. Growth hormone, GH, make sure you get that one. Potassium K plus, make sure you get that one. I'm just looking at a few of them, but you guys still have the same thing, T1D, T2D. You guys know what that is, type 1 and type 2 diabetes, okay? Some of the ones that are easy, that's what's going to be on the test. I know, my strawberry. Okay. TSH, thyroid stimulating hormone. Make sure you get that. All right. Practical applications. We already know insulin. Here's our special one right here. Okay, y'all. So they gave people the GL shots so that they can lose weight. And like Dr. Now was talking about this a while ago, like 2 days ago. Dr. Now was talking about how somebody had a question of, does he give his patients that? And he said, yeah, they've been giving, patients that for years. And again, my mother, and anybody who had, diabetes, taking the Ozempic. The Ozempic, I think, it still helps people who have had diabetes or people who just need to lose weight, just lose the weight because they've been giving it to diabetics for years. And it's, the effect that I see is this thing right here. You start getting that skeleton look when you lose too much weight. I I don't know about the other ones. What are the other ones? Wegovy and some of the other ones. But again, it has to do, with your full endocrine system. You need to lose weight. They've been giving it to people. Endocrine medicine, brand names in parentheses that we're going to say. You guys can't see it, but I'm going to give it to you. Insulin, injected synthetic hormone, lowers blood sugar, comes in short acting and long acting forms. Used in type 1 and type 2. You see that? Oral hypoglycemic medication that reduces glucose production by the liver and increases the body's sensitivity to insulin, used in type 2. I'm not saying it right, but y'all know what it is. Semaglutide. How do you say it, y'all? Semaglutide. Oral or injectable. They're using Ozempic as an example. T2D medication, type 2 diabetes medication. So that's what they have it in here as. They don't say nothing about losing no weight. They have semaglutide as lose weight medication. Now they have it in here as oral. So I'm thinking when you lose weight, they probably give it to them in an oral solution, in an oral pill. Because after you have the surgery, I don't remember any of my people taking shots. I mean, they taking pills. So maybe that's what that was. Okay. Thyroid medications. Okay. That won't be like a specific, but I mean, you can get them down. I mean, the insulin and the semaglutide may be what's going to be on your chest. Okay. So here now they have the questions. I'm going to see if they have any cases down here. One of the questions is, which endocrine medicine treats hypothyroidism? Which endocrine medicine treats type 2 diabetes? I'll give you the question. Give you the answers for the first one. Prednisone. That's not, it just said prednisone. Lifelonin, Profithol. That's because I got the drop down box. Let me show you. I have a drop down box. That's what I'm looking at. See, that's the drop down box, and I'm trying to show y'all what answers they're giving y'all, but it won't let me show y'all. But if you get your book like that, ebook, it's going to show it to you like that. The book that I have for you guys that's free, I think it shows it like this. But this is a 2025 book. It has a lot more stuff in it than the older book. Okay, so which endocrine medicine treats type 2 diabetes? Which endocrine medicine treats osteoporosis? Okay, so we're pretty much at the questions part. And it just says living with diabetes. And it's just really giving you examples of, how people do live, with diabetes and, the things that they have to do. And I love this section because this was a very big, I didn't think this section was actually this big, but you guys remember the other day we were looking for it. And again, it just follows the same type of narratives. I mean, you still have to take care of yourself, whether it's type 1 or type 2. And they're just showing that the child that we just saw, he's 8 years old. He has type 1 diabetes. And let me show you what this is. So this is probably in your book too. This is not a case that you're going to code, but this is like an intake. So the provider has an intake that he has, and he's giving the history of the patient. It's an HPI, history of patient illness. This is what you're going to look at when he gives you your whole record. Let's say you're trying to decipher the diagnosis. He should have the diagnosis in there already. But sometimes the patient don't leave with a diagnosis. You have to put what the patient came in with. Okay, and this is pretty much HPI, and it's just telling you the patient's history. Okay, I told you, wait till we get to the coding. Is this the same child? I guess he grew up tall or something. I don't know. Today's technology lesson burden. Okay, so this is the same child. I guess he just grew up that big. I got to show you how big he is now. Look how big he is. I bet he get ready to grow out of that. He get ready to go out of that. Abacus, how are you? Okay. She has diabetes insipidus. Diabetes insipidus. I was drinking what it seems like a gallon of water a day. I first thought I was great. So she's telling, her feelings, and that's again. These are patients that these are patients that have went to the medicine doctor and telling the provider what happened. What's going on. How do I feel? She's literally giving her HPI. She's telling how she feels. She's telling who has it in her family. She's giving her story. What time is it? Okay, we have a few minutes. But this probably won't be an hour, but let's get through the whole thing. The first person account was written. Okay, so we don't need that. We saw that. They just have a lot of pictures of people who have diabetes in here. Okay, so match the endocrine. These are exercises that you're going to do. What's behind the stomach? Posterior side of the thyroid gland. Intersection of glands. These are questions that you do need to answer, okay? Because guess what? When you do these, you never know. AAPC may have taken questions from somewhere else. Vasopressin, insulin. These are drugs they want you to tell what they're used for, okay? And yes, this is very important right here. Make sure, I'm on page 732. Answer these questions. Make sure you answer these questions, okay? This class will not be the whole hour because we're almost finished with it. Okay, so we do have abbreviations: ADH, LH, FSH, TSH. You guys already know I want you to do the abbreviations. You're just going to fill in the answers. This is where I'm at. You're just going to fill in the answers. That's it. Same thing, matched questions. Okay, I'm trying to see if there's a case down here. Graves' disease, Cushing's syndrome. Yeah, they want you to answer. I want you to answer that too. Those are good questions. 734. Cushing's syndrome. Sometimes there's cases down here. I don't see any. These are questions that you guys are going to do. Diabetic nephropathy, diabetic coma, atherosclerosis. You're going to put your answers down there. Gastroparesis, insulin shock, fasting plasma. All right. So we had cases last time. What happened? All right. These are questions. So after every chapter, you guys will have questions, okay? Exercises. There are exercises. All right, so this chapter doesn't have any cases. Cases as in coding cases. Pregnancy hormone, yeah, you're just checking your answers here. Endocrine. So this one is over. Endocrine is over, but it was a very interesting part. The diabetes section was amazing. It was amazing. So that video that was before you, I got that video in private because I need to edit that video. So once I finish editing that, we're going to go ahead and release that video. Okay, so you guys have any questions, send me an email. Let me know if you want to join the program. Go on sapphirephysiciancoding.com. Check those notes on this side. I put all that information up there. Your ICD-10, your CPT books are definitely there. They are from the Kindle. I do recommend to purchase them from the Kindle if you want to get the ebooks. Okay, so this class is over. There is a chat tomorrow. Do not miss that chat. I have not put the chat up for the next class. Your next class is going to be Chapter 19, Oncology. I think that's what's next. Chapter 19, Oncology. That is what's next. I will see you then. We're going to end this chat. But before we go, let me just retract. When you go on sapphirephysiciancoding.com, you're going to hit that button in the middle that says see more courses. Okay. When you go in there, that's when you're going to see all the courses. On September 15th, I'm going to put those courses back to the regular tuition. Okay. So just be precarious of it. Okay, good. Because right now, you guys know, good, Valerie. So you guys know I always do tuition reduction during the summertime. So now on September 15th, administration is going to automatically revert that. So you guys have registered for the classroom. Administration is going to send you an invite. They will get an email. They're going to get an email. Once you purchase that course, they automatically get it. Okay, you're going to get email, you're going to get invoice, you are going to get syllabus, you're going to get your orientation is going to be in that download. So when you purchase those courses and you say and then you have all that download, you're going to download all those courses. If you have a problem with that download, let me know. Let me know if you have a problem. When you go to checkout, you should be able to download those courses with no problem. It's going to say, do you want to download these courses now? I'm gonna share my screen real quick with you guys just to kind of show this to you since we haven't gotten through our hour just yet. So I'm going to share my screen to the bookstore. So that's the bookstore. So when you guys go on my website and you click that little thing that says see more courses, this is the advanced course. So this course is $59, right? So when you go in there and you say add to cart and you get ready to check out, it's going to ask you, do you want to download this course? So when it asks you, do you want to download this course? Yes. And this store is going to automatically send you the courses. All the courses are in there. So when you get right here, you guys see right here where I'm looking at? On the site, it actually tells you what it's going to do. It says you can download each one of these courses one by one, or you can just get the automatic downloads. You do not need to download one at a time. You can download as you go. Just continue to use the same code. So let's say we're in medical terminology, right? So if we're in medical terminology, I'm coming back to you. So let's say we're in medical terminology and you have access to all of the classes. You don't have to download. You can download when you're ready because I've already given you that code. You see what I'm saying? So if you have code 233 and I gave you that code to download I don't know why this is doing it. And I gave you that code to download all of those classes, you can use it repetitious. So if we're doing medical terminology, go ahead and download the medical terminology. The orientation is automatic. That's going to download to you automatically. The code that you have, that's how you download the rest of the classes. You see, so we're on medical terminology. Go ahead and download that medical terminology and make sure you read what's over here. Let me get over here so I can push it down. So when you get over here, because this is on the side, is really telling you how you're going to download those courses. After you register for the course, you will request a code to register the courses below in a separate checkout. You can load several or you can load one at a time. The code is already in there. Okay, so you guys let me know. I will give you that code and then you can go ahead and use it. Okay. So when you first do your download, you're going to see orientation because that's what you do first. Before you even do any kind of download, you do the orientation. So when you first get a load, you're going to see all that is the orientation. All that's the orientation, okay? When you see that orientation, your download code is right there. As soon as you open it up, that's your download code. So email me if you guys have any questions. I'm going into the Sapphire portal right now. So you guys can go ahead and DB me, DB as in discussion board. Remember, discussion board is everything. Discussion board is FaceTime. Discussion board is email. Discussion board is YouTube. Discussion board is everything. I will not make this one private because this is part of the first endocrine. This will not be private. The other one, I'm editing that and I have not put it back out yet. The one with the why can't we find a job? It's just something that people were asking me to do. It's not part of your class, just, something I always do. Definitely give you guys what you want. So if you guys have any questions, let me know. Okay. Don't forget when you go in that website, when you go in that bookstore, your first thing you download is your orientation. Your code is in there for you to download all the rest of your courses. When you download your courses, put them in a folder so that you're not all over the place. So your first folder, you're gonna make a folder for medical terminology. You're gonna make a folder for medical billing. You're gonna make a folder for coding. You're gonna make a folder for endocrine. You're gonna make a folder for musculoskeletal system. So when I'm doing those chapters, all of your notes will go in that folder. All of your notes will go in that folder. It's just like coordination. It's coordination. So some of you, I have not went through. Well, I think I did. I went through the Sapphire portal with you guys. All y'all have to do is just find that chat. I think it was the chat before the one I just did for the Sapphire portal. So you guys can actually find that playlist, and you can just kind of follow along with what's in there. But when you actually join the Sapphire class, that's how it's going to be. What we want to do is try to make it as easy as possible for you to get the courses, okay? And I can download and send you anything you need, because this is how you self-teach. This is how you work on your own. There's no micromanagement, but I stay with you, okay? And you and I, we get to do one-on-one, and I'll put you in the right place, okay? Okay, Valerie, I'll be hearing from you soon, Valerie, okay? Okay, guys, so I'm going to sign off now. I got to go in the classroom, and I'll see you guys tomorrow. Don't forget that next chat tomorrow is Friday. We have chat Monday, Friday, and Saturday, 6 o'clock, okay? When I do chats earlier, I have more time. I had time to do earlier chats, okay? So I'll see you then. If I jump out with something in the morning, I'll let you guys know. But Monday, Friday, and Saturday, 6 o'clock, that's your chat time, okay? Bye-bye.